Let's now. Hello everyone, I'm Leandro and I'm the industrial hygienist for Analytics Corp in Brazil. I have here with me Jeff Spink, CEO for Analytics Corp, Andy Teague, our lab director and our CIH, and Jack Simula that handles our customer service department. He is our manager. So let me introduce you guys for this webinar. It's the new piece of content that we are doing here for USP 800, hazardous drugs. And we are willing to give you a lot of content about this new regulation. Can I say that, Jeff, about the USP 800? That's something new that's coming up in US about exposure to some chemical drugs that people use usually in hospital and so far. But I think here now I'm gonna talk to you, Jeff. And so Jeff, our CEO, can you explain a little bit to everyone what is USP 800 and why we are talking about that?
Yeah, great. Thanks, Leandro. I'm very excited. This is our first webinar, and we hope to do many of these down the road. We felt that USP 800 was a good starting point, and I asked Leandro to help us with it because Leandro has been doing webinars, podcasts, a lot of this social media type of work for the last several years. We opened an office in Brazil and to let people know who we are and to help them with technical advice. We created this type of a program, first of all, in Brazil, and now and it's been very successful. And now we're going to try and do it here in the U.S., specifically with USP 800, and then eventually a lot of other topics, related to the lab and a lot of, AIHA, NIOSH type of procedures to hopefully give you a little bit of our experience. We've been around since 1979, and so we know a lot about doing laboratory analysis, and the USP 800 has become kind of our latest type of lab work. It kind of evolved from our days of being owned by a large pharmaceutical company. In the early 80s, we were owned by Hoffman La Roche. We kind of served as their internal lab, and we developed a lot of procedures. And maybe, Andy, you can talk a little bit about kind of what that means.
Okay. Well, we're an AIHA accredited lab, American Industrial Hygiene Association accredited lab for a range of fields of testing. One of those fields of testing is pharmaceutical testing. There's some additional requirements of a lab under that portion of their accreditation. One of those requirements is proficiency in a proficiency round. It's a controlled round robin populated by pharmaceutical manufacturing labs and contract labs, probably about, I don't know, maybe half and half now. So we're in that program, proficient in that program, but analytics, I'll go back and emphasize what Jeff said. Analytics experience in pharmaceutical testing for air samples, wipe samples, surface samples, residues in materials. The experience is it's been there a lot longer than the USP 800 program. So we've developed methods for a range of active pharmaceutical ingredients, APIs, in air, on surfaces, and again, it's not new to USP 800. So we're looking at dermal exposures and surface sampling related to dermal exposures. Not exactly dose measurement. It's not like air sampling. It's surface sampling for contamination as part of a risk assessment. That's part of USP 800. We do a lot of air samples for pharmaceuticals. That's mainly from manufacturing operations where they know that they're generating potentially aerosols, and it's a greater exposure in that case than potential exposure than the surface sampling.
Hey, Andy,
Yes, sir.
let's have Jack for a minute kind of explain a little bit about the collection kit that we used to do the sampling. As you said, USP 800 is a procedure that talks a lot about protecting the safety of the people that are working in a healthcare setting, mainly a pharmacy or a laboratory where they're working with these drugs. But it can also mean, the area where they receive it, the area where they process it, maybe where they administer it. And so what we do is we provide, a kit. And maybe Jack, just take a couple of seconds to talk a little bit about the kit that they'll be using.
Okay, thanks, Jeff. My name is Jack Simula. I'm the customer service manager for Analytics Corporation, and we run the group that would take care of you as you call in. We have a number of members in our customer service team that are also project managers. When you call in, if you have any questions about sampling, well, let's start talking about the kits first. When you call in to order your kit, our kits are completely customizable. So whether you want one sample in a kit or you want 50 samples in a kit, we can accommodate your request. The kits will include a sample set, and a kit will include two swabs for doing your sampling, a test tube to put your swabs into when your sampling is complete, a label to label your tube, a pair of gloves, and a vial of water as a wetting agent to collect your sample. So when you call in, all you have to do is tell the customer service rep or myself, I need a kit that has 5 sample sets in it, and we'll take care of the rest. We'll put that together for you and ship it out to you. One thing I forgot to mention was that every kit we send has a prepaid FedEx overnight shipping label and a chain of custody for you to submit your samples with. And the best part about it all is that we do not charge for our kits. This is completely free to our customers, and it's part of the service that we provide you from Analytics.
Nice.
Okay.
Hey,
Thanks.
Jeff, I have a couple questions here because, as everybody see from my accent, I'm talking from Brazil, so and USP 800, no, it doesn't work here in Brazil. But I think to clarify here for our audience here, how did it started? Why people should be concerned about hazard drugs and about in hospitals, pharmacies, and why did all start when it started? And I think that it's a good way that people that's watching us right now could thinking about if they have this type of exposures in their facility.
Yeah, it's a great lead in because after introducing analytics a little bit, I wanted to talk a lot about the USP 800 because I think that's the most important part here. USP 800 was developed primarily to address the safety issues within the healthcare facility related to working with hazardous drugs. NIOSH came out several years ago with a list. I think, Andy, it's over 200 drugs, if I'm not mistaken, right?
Yes.
That are classified as hazardous drugs, meaning if you're exposed to these drugs, there could be health issues related to that. So that's kind of what USP 800 is. But if you trace the roots of USP 800, it was really kind of an offshoot of USP 797. USP 797 was drafted in the early 2000s, and I believe went into effect. It was enforceable January 1st of 2004. And USP 797 again dealt with hazardous drugs, but it dealt with the cleanliness of putting together the drugs. In other words, making sure that the hoods and the facilities were clean. You may recall in the early 2000s, there were some real, bad problems with compounding pharmacies working in hoods that actually had mold and fungal exposure, which got into the drugs. The drugs were given to the patients, and patients died. So that was kind of how 797 was developed. 797 was revised, I believe, around 2008. And at that time, they discussed the idea of not only the cleanliness of the facility and making sure that the drugs are being compounded in a very clean, sterile environment, but then also they started discussing, well, what about, exposure to these drugs? What should we do about that? Well, and that was really the advent of USP 800. So I believe the first draft of USP 800, and we'll talk about that in a couple of minutes, but I believe the first draft was in 2014. And I think it was actually published a couple of years later, say 2016. And it was originally slated to be enforceable in 2017. That was postponed. But then finally in December 1st of 2019, it became an enforceable ruling. And the USP, United States Pharmacopoeia, they're not the people that enforce it. They're the people that develop it. They're more of a scientific organization that develops these procedures. The enforcement is done by either the FDA, the Food Drug Administration, or by the actual state pharmacy board. They'll come in and do the inspection and decide, are you following the new USP 800 guidelines? Is the facility clean, and are you doing everything as stated in the policy? And let me just talk about that for a minute. I made some notes here. The USP 800 relates to the health and safety of exposure to hazardous drugs. It addresses the facilities, meaning designated areas for the storage of the drugs, compounding of the drugs. It discusses engineering controls, the personal protection equipment that you need to be using, hazardous communication, training, cleaning, decontamination, and the area that we kind of fall under, environmental quality and control. That's where the wipe sampling is addressed, that you need to be wipe sampling the areas within the facility where the contamination can be occurring. And then finally, it addresses spills, documentation, medical surveillance. So that's kind of the USP 800. This document right here is the actual document, USP 800, USP General Chapter 800, hazardous drugs, handling in a healthcare setting. I believe, Jack, we have this on our website.
I don't know for sure. Do we?
I think you can click on our website, and it's somewhere there you can download it, if I'm not mistaken.
What I can do too, Jeff, is
that's a little bit about the USP 800.
Jeff, but before you go to this point, so I want to put the link here on the description of this video here in YouTube. So
Okay.
anyone that's watching it here, so they can download that and they can have access to this document. So I'll do that. So
USP offers free access off of their website. You could link to there, but they do require you to identify yourself essentially, and you have the option to connect for additional communications, and then they'll allow you to download their standards.
Perfect. I'll do that, and everybody that's watching us here, that they have access to this document.
So again, when you're talking about USP 800 and kind of our role in it, it's to do wipe sampling. And wipe sampling really, I believe, Andy, addresses what type of exposure. And maybe you could talk just a little bit about, exposures in general.
Well, the wipe sampling guidance that's provided by USP 800, there's not a lot of guidance there. What they're trying to educate the users about is the idea of using the wipe sampling as a risk assessment tool. The contamination on a surface doesn't represent a dose. It represents the potential for a dose.
Sure.
And there are requirements in place for personal protective equipment as well, like gloves. So that's going to combat that surface contamination from becoming a dose. But cleanliness in the operations of an administering facility, cleanliness in those operations is part of the control to minimize the risk assessment. Now, I mentioned airborne exposures, and we have some customers that are worried about that in an administration setting, but that's not strictly what USP 800 is addressing. We have some customers that are addressing preparation of dosing on site and crushing tablets and making solutions for administration. And so they've got some increase in the potential for airborne exposure. And USP 800 addresses the healthcare workers in the setting, but it also addresses patients as well. It's worried about unintentional dosing of patients. Dermal exposure, it's hard to turn that number into a dose. So to a dose or a risk assessment. So their intention is not to have you think that the surface measurement demonstrates or contamination on the surface demonstrates what the exposure is going to be, or that lack of contamination. What they're shooting for is for you to use that surface contamination measurement as a gauge of the suitability of your practices. And contamination indicates, the measurable contamination indicates that those practices need to be improved. The choice of drugs to monitor on the surfaces depends on what the process is. They mention a little handful of drugs in the USP 800, and in some facilities, those are the primary drugs that are being administered in that facility. So those make good test candidates, good marker compounds for assessing the cleanliness and the control in that operation. We have customers that, because of their particular applications or uses, don't find those to be useful measurements. And so in those cases, we're developing methods for other active pharmaceutical ingredients. So the list kind of ever increases, and it's dependent on the operation. But again, that surface sample is not to establish exactly exposure. It's really intended to establish control of the operation and the cleanliness of the operation.
Andy, I have a question about this. Should we, as an industrial hygienist, concerned about skin penetration or something about these IPIs or these hazard drugs, or just
most of the drugs are they're formulated to be absorbable, orally or as an injection, as an injectable, but they're formulated to be able to be human friendly. So the potential of absorbing a dose from those drugs by contact with the surface, the potential is certainly there. That's why they're That's why USP 800 is emphasizing that. But again, it's not like an OSHA lead standard of 50 micrograms per cubic meter being the PEL. 50 micrograms per cubic meter, we do some modeling, assume people are going to inhale a certain quantity of air in the course of a day, and they're not going to get the agent when they're away from work, and you can figure out what the body burden is going to be from that. That's not really what they're trying to accomplish with the USP 800 for surface contamination measurement.
I think it's important also, Andy, to point out right now, the primary focus that we're seeing is what? Basically the chemo drugs, correct?
Yeah, the extremely potent drugs, the greater the potency of the drug, the greater risk there is of a biological effect from unintentional dose, adsorption, I suppose even injection, but that's pretty well understood. But the more potent the compound, the greater concern about an unintentional dose, because the smaller amount is going to be biologically effective.
Sure.
And the anti-neoplastics are at the very heart of all of this. But that's not the only concern.
Right. Yeah, I know that. We seem to have lost Jack, but
Am I gone?
Video is gone, Jack.
The video's gone. But what I was going to ask you, Jack, is can you kind of explain to the customer, what drugs that we offer as it relates to, USP 800? I think we have 4 different categories or something like that. Could you just briefly go through that kind of chain of custody information with the client?
Yeah, sure, Jeff. Right now, we offer approximately 11 different drugs that we call our Group 1 drugs, and we're constantly working on more to add to this group. And they cover drugs such as 5-fluorouracil, cyclophosphamide, dodexal, doxorubicin, epirubicin, etoposide, Phosphomide. Yeah, I don't know if I need to be saying these.
I'm glad that Jeff didn't ask me to say that, because when I look at the
Maybe
names,
what I should say is I don't know, maybe we should say that we are covering, we have a large number of samples we cover, and we have 4 basic groups that we
That's what I wanted. Yeah, I wanted you to go through the 4 basic groups.
And then do you want me to name the drugs?
No. Like, I've already introduced that we're doing mostly chemo drugs. What I wanted you to tell is that, we have Group 1 drugs, about 11 or 12 drugs fall into that category, chemo drugs. They can all be run together on the same swab. Group 2 drug is gemcitabine.
Gemcitabine, yeah.
And that has to be run by itself. Group 3 would be hormones, right? Is that Group 3? And Group 4?
Yeah, that's big.
And Group 4 would be the platinum drugs.
Our platinum drug, which we run by ICP, mass spec, and then I could probably turn it over to Andy. And
that's what I wanted you to do. Yeah, that's what.
All right. Well, I'll start over again. Our 4. What we have, Jeff, is 4 major. We classify the drugs that we do into 4 major groups. Group 1 are your basic chemotherapy drugs, which we have at least 11 validated right now. We're working on some others, and we're constantly adding more drugs to our list. Group 2 is our gemcitabine. Group 3 are the hormones that we run, and Group 4 are the platinum drugs. And before I turn it over to Andy to talk about the platinum drugs, I did want to mention that when we classify these in separate groups, all Group 1 drugs can be sampled off of the same swab, but Group 2 and Group 1 cannot be mixed. So if you want something from Group 2, which is gemcitabine, you have to have a separate swab. And you would have to have a separate swab for the hormones and a separate swab for the platinum drugs. So I'll turn it over to Andy to talk about the platinum drugs or any of the other drugs and how we go about testing those.
Well, the analysis for the platinum drugs is, as Jack mentioned, it's ICP mass spec. They're being tested based on their platinum content. It's elemental analysis, very sensitive elemental analysis for platinum. And the result is expressed as a single value representing the group of platinum drugs, carboplatin, cisplatin, oxaliplatin, the group, it's non-specific. The other drugs are being tested by HPLC, typically HPLC mass spec. But there's some other possibilities that we're using for some of the drugs and surrogates as well.
And we're going to get into all that, Leandro, at a later date. Really, in later videos, we're going to go into really the science behind it, the quality control that we put into it. But for now, I think it's just important to point out that there are groups that we classify, but they're all mainly related to chemotherapy right now, because that seems to be where we're getting a lot of requests. But that doesn't mean that we can't do any of the other hazardous drugs as NIOSH has published. And again, another document that our clients may want to get, and that we're going to post on our website, is NIOSH list of hazardous drugs for 2016.
Nice. I think, Jeff, it's we did a great piece of content for everyone here, and I really believe that it's going to be really helpful, because this is something that has been discussing. I remember the last time I were with you guys in US, and I remember that we've been talking about USP 800 for like 2 or 3 years, and people still don't know a lot about this. That's why we're doing these webinars. And along this year, we're gonna have a lot of more. But if you could summarize this, Jeff, for everyone that's watching this, for you, I think it has a lot of experience about USP 800. Who should care about this, and who should be taking care of USP 800? Which facility? There is a type of professional over there that should take care of this, or is it industrial hygienist? Is it a pharmacist, or it's a nurse? How can you handle that?
That's a great question, and I believe there's a lot of confusion as it relates to that, because I put together some numbers, Leandro, today, which I think are important. This USP 800 regulation really governs hospitals. In the US, there's over 6,000 hospitals. It governs pharmacies. There's over 67,000 pharmacies in the United States. Healthcare clinics, if they're working with hazardous drugs, there's 246,000 healthcare clinics in the United States. It covers nursing homes, 15,000 nursing homes. Even veterinarian practices, there's 60,000 veterinarian practices. So what I'm trying to point out here is you've probably got 300,000 or 400,000 potential places, and how do you handle that? We've worked a lot with a group called Siga, and that stands for Controlled Environmental Testing Association. They're kind of the certifiers, and they're very active in working with healthcare facilities to help them with their USP 797. So that's a great group to call. All of these facilities probably in some form or other are working with someone that's part of the Siga organization. So of course, you can draw on that group to help you. The other group, certainly the pharmacist or the techs working in the pharmacy area can be a great resource. And what I had Jack tell you about was the sampling. Send that sampling kit out. You can do the wipe sample where you suspect there might be contamination. Send it back to us, and we can do an analysis on that and tell you if you got it. So, what I guess I'm trying to say in summary is that this entire regulation, USP 800, this entire regulation can be really handled by almost anyone that's involved with the healthcare facility. It doesn't take some highly trained engineer or consultant like in the case of maybe going out and doing an industrial hygiene study. That's, I think, what you're familiar with. You go out, you do a whole full-blown industrial hygiene site assessment. That's not what's necessary here. What's necessary here, I believe, is trying to determine, do we have a contamination problem in our facility? And if so, how bad is it? And that provides you information to know that, hey, I got to do some cleanup. And all of that we're going to cover in later videos. But, hopefully that kind of summarizes and answers your question.
I'd put it a little differently. I would say that if you look at who's addressing this now in facilities, it's widely varied. When we first started to be involved in this, the people that were coming into these facilities and testing for whatever became these healthcare facilities experts, because they were the people that were already in there for testing. It could have been industrial hygiene consultants that were coming in to do monitoring in a histology lab. Well, they're our samplers. So they became the people that developed some skills in identifying areas to sample and accomplishing the sampling and interacting with the lab. We see that with pharmacists. We see it with pharmacy techs. We see it with some of the more broadly distributed facilities. There'll be a central person that's responsible for the various facilities. They may have a rep at the facility that's the hands-on, but the guidance is coming coming centrally. But it varies a lot, and it depends on what you're trying to address. If it's just sampling, well, that's a pretty straightforward. The lab can give you instructions and support you for the sampling, and that gives you some measure, that surface contamination measure, that is a component of USP 800 for exposures in healthcare facilities. USP 800 also lays out, in 797, they lay out some requirements. They don't exactly match in the requirements for what kind of controls are necessary at what point in various operations as far as engineering controls. If you start to put in engineering controls and designing a suitable hood in a suitable space, well, you need an engineer.
Sure.
But for that part of it. And it also depends how you address this, depends on what your goal is. Is this for US compliance with 797 as it specifies USP 800? Well, 797 doesn't exactly specify USP 800. Is it 800 to meet Joint Commission or some other purpose? Well, if it is, that lays out a different set of requirements. So you set they need to set, just like for industrial hygiene monitoring, set your goals first and then figure out how you're going to accomplish those goals. Right now, it's a pretty mixed bag of how people are trying to accomplish those goals.
Okay, for today, I think that's it we have, guys. And I appreciate our time here. For me, it's a new experience having 3 of you guys here online, and we're doing this content. It was our first webinar, but we're gonna work that soon, and more episodes for this webinar as Jeff said in the beginning here, with USP 800 and more topics for industrial hygiene. I'd like to thank you guys for your time, for buying this idea, and me pushing you guys. I've been trying to do this and for a long time, and finally we got you guys hooked on that. And I'm really glad that we had this opportunity to talk here and try to help people understand a little bit better about this USP 800. So anyone want to give their final words, and so I would
Thank
say
you.
goodbye from Brazil.
Thank you for putting this together, Leandro.
I think this is going to be great. Send it over so we can all critique it, and we'll do it again next week. Same time, same place, same bat channel.